Question 1. In the context of radiology accreditation, the American College of Radiology ACR has established a rigorous process for evaluating radiology departments and facilities. One of the key components of the ACR accreditation process is the importance of demonstrating a high standard of patient care. Within this process, facilities must adhere to guidelines relating to equipment calibration, staff training, and quality control measures to ensure accurate, safe diagnostic results. During a recent internal review at a radiology facility, it was found that the staff had not completed the required annual training on new imaging equipment, which could potentially lead to inaccuracies in imaging results. What should the facility do to ensure it meets the ACR accreditation standards? A. The facility should schedule immediate staff training sessions to ensure compliance. B. The facility should immediately replace the equipment with the latest models to satisfy ACR standards. C. The facility should submit a report to ACR explaining the delay and request an extension. D. The facility should continue with the current equipment and training schedule as there is no immediate risk. Answer. Correct answer A. The facility should schedule immediate staff training sessions to ensure compliance. Explanation. The ACR accreditation process requires facilities to ensure that their staff is adequately trained in the operation of imaging equipment to ensure quality diagnostic results. Failing to complete necessary training can compromise the accuracy of imaging results, which would not meet the accreditation requirements in accordance with ACR guidelines. Ulster should undergo regular and updated training to keep pace with evolving technology and ensure safe patient care. Question 2. Based on the information available, the ALIRA principle, as low as reasonably achievable, is central to radiological safety. This principle guides the reduction of radiation exposure to both patients and healthcare providers to levels that are as low as reasonably achievable, taking into consideration the benefits of the diagnostic procedure. In a medical imaging facility, a patient is scheduled for a ECN, which typically involves high doses of ionizing radiation. The radiologic technologist, however, is unsure whether a different imaging modality, such as an MRI, might be appropriate for the patient, as it does not involve radiation. Which of the following should the technologist do to ensure adherence to ALIRA? A. Proceed with the CT scan as planned, as it is the most efficient method for the diagnosis. B. Suggest the MRI to the physician as an alternative if radiation exposure is a concern. C. Continue with the CT scan and request the radiologist to assess the radiation dose after the procedure. D. Delay the imaging procedure until further consultations are made regarding the patient's radiation history. Answer. Correct answer B. Suggest the MRI to physician as an alternative if radiation exposure is a concern. Explanation. The ALIRA principle emphasizes minimizing radiation exposure whenever possible without compromising diagnostic quality. MRI, unlike ET scans, does not involve ionizing radiation, making it a preferable choice when it is clinically appropriate. The technologist should collaborate with the physician to explore alternatives that align with the principle of minimizing radiation exposure. Question 3. Several experts suggest that with the increasing use of AI in radiology, new concerns about data privacy and patient consent are arising. A hospital recently implemented an AI-powered imaging system to assist radiologists in diagnosing conditions based on image analysis. While this system has proven to be highly accurate, the hospital has yet to update its informed consent process to reflect the use of AI in image interpretation. What should the hospital do to address these concerns and comply with regulations like HIPAA? A. The hospital should continue using the AI system as it does not require informed consent since it is part of the diagnostic process. B. The hospital should update the informed consent process to explicitly include the use of AI and obtain patient consent. C. The hospital should request approval from the AI company to ensure compliance with HIPAA. D. The hospital should inform patients after the procedure about the use of AI with changing the consent process. Answer. Correct answer. B. The hospital should update the informed consent process to explicitly include the use of AI and obtain patient consent. Explanation. Under HIPAA regulations, patient consent must be obtained before utilizing technologies that affect their personal health data. Since AI is now involved in interpreting patient imaging, it constitutes a change in how health data is processed and analyzed. The hospital must update informed consent process to notify patients and obtain consent, ensuring compliance with both patient privacy laws and ethical standards. Question 4. In light of recent developments, radiation protection principles have become a significant focus in radiology practice. A radiologist is reviewing a patient's medical history and notes that the patient is pregnant. The patient needs an X-ray to diagnose a suspected bone fracture. The radiologist is concerned about the potential risks of ionizing radiation to the developing fetus. Which of the following is the most appropriate course of action for radiologists to take? A. Proceed with the X-ray immediately, as the benefit outweighs the risk. B. Consult with a medical physicist to determine the lowest possible radiation dose for the X-ray. C. Recommend an alternative imaging modality such as MRI, which does not involve radiation. D. Delay the X-ray procedure and advise the patient to seek treatment later when not pregnant. Answer. Correct answer. C. Recommend an alternative imaging modality such as MRI, which does not involve radiation. Explanation. The ELARA principle and radiation protection guidelines emphasize minimizing radiation exposure to sensitive populations, such as pregnant women, whenever possible. In this case, an MRI would be an appropriate alternative to X-ray imaging since it does not involve ionizing radiation. The radiologist prioritize patient safety and explore non-radiation-based diagnostic options as recommended by radiation protection principles. Question 5. To what extent does the ACR accreditation process address the role of radiologic technologists in quality control? Radiologic technologists are responsible for ensuring that imaging equipment is functioning properly and producing high-quality images. However, a recent audit of a radiology department revealed that certain equipment had not been calibrated for over 6 months, potentially affecting the accuracy of diagnostic images. What should the department do to meet ACR accreditation standards? A. Perform immediate calibration of the equipment and document the results. B. Retire the equipment and replace it with new models to meet accreditation standards. C. Schedule the calibration for the next available time slot, as there is no immediate impact on patient care. D. Continue operating the equipment without calibration as the images are still of acceptable quality. Answer. Correct answer. A. Perform immediate calibration of the equipment and document the results. Explanation. The ACR accreditation process includes rigorous standards for the performance and calibration of imaging equipment. Regular calibration is essential to ensure high-quality, accurate diagnostic images. Failing to calibrate equipment could result in inaccurate imaging and compromise patient care. To meet ACR standards, the department must immediately address, issue and ensure all equipment is properly calibrated and functioning. Question 6. What factors contribute to the success of a quality improvement initiative in a radiology department? The hospital recently implemented a quality improvement program to reduce patient wait times for imaging procedures. The initiative includes streamlining patient scheduling, optimizing workflow, and reducing equipment downtime. However, early feedback from staff indicates resistance to change, as many radiologists and technologists are accustomed to existing practices. Which of the following strategies is most likely to increase the success? Quality Improvement Initiative. A. Compulsory training sessions for all staff, emphasizing the importance of the new program. B. Ignoring staff feedback and continuing with the current plan, as the changes are necessary for compliance. C. Engaging staff in the planning process and incorporating their feedback into the initiative. D. Reducing the scope of the initiative to avoid overwhelming staff with too many changes. Answer. Correct answer. C. Engaging staff in the planning process and incorporating their feedback into the initiative. Explanation. Successful quality improvement initiatives rely on collaboration and buy-in from all stakeholders, including staff. Resistance to changes, a common challenge in healthcare settings, and one of the most effective ways to address this is by involving staff in the planning process. This can help identify potential challenges, ensure that change is feasible, and foster a sense of ownership and commitment to the initiative. Question 7. The general consensus is that radiation protection for healthcare providers should be a priority in radiology departments. In a large hospital, a radiologic technologist regularly performs fluoroscopic procedures, while the technologist wears a lead apron for protection. The radiation dose during these procedures is still higher than standard X-ray procedures due to the prolonged exposure time. What should the hospital do to further protect the technologist from unnecessary radiation exposure? A. Equip the technologist with a lead apron and gloves, as well as provide continuous monitoring of radiation exposure. B. Provide additional shielding, such as protective barriers or a shielded booth during fluoroscopic procedures. C. Limit the number of fluoroscopic procedures performed by the technologist to reduce exposure. D. Advise the technologist to take frequent breaks during procedures to minimize cumulative exposure. Answer. Correct answer. B. Provide additional shielding, such as protective barriers or a shielded booth during fluoroscopic procedures. Explanation. While wearing a lead apron is essential, it may not provide complete protection during prolonged fluoroscopic procedures. To reduce radiation exposure to healthcare providers, additional shielding, such as protective barriers or a shielded booth, is recommended. This approach is aligned with radiation protection principles and helps minimize unnecessary exposure. Question 8. In terms of radiology, what is the most significant aspect of quality control for imaging equipment? A radiology department recently identified that some of its MRI machines were producing images with slight distortions, potentially affecting diagnostic accuracy. The department has invested in new MRI machines, but it is uncertain whether the equipment's calibration and performance have been thoroughly tested since installation. What action should the department take to ensure ongoing compliance with quality control standards? A. Perform immediate calibration checks and test all MRI machines for image quality and performance. B. Schedule regular calibration checks and report the issue to the equipment manufacturer for further testing. C. Rely on the manufacturer's certification and focus on operational training for staff. D. Wait for the next routine accreditation review to address any quality control issues. Answer. Correct answer. A. Perform immediate calibration checks and test all MRI machines for image quality and performance. Explanation. Quality control is a critical aspect of ensuring diagnostic accuracy and patient safety. Regular calibration and performance checks are necessary to maintain the integrity of imaging equipment. If any distortion or malfunction is detected, immediate corrective actions should be taken. Waiting for the next accredit review would delay addressing potential issues that could impact diagnostic outcomes. Question 9. The foundation of patient safety in radiology practice lies in effective communication between radiologists, technologists, and patients. A radiologic technologist is preparing a patient for a chest X-ray, but the patient is anxious and has difficulty following the instructions. The technologist recognizes that clear communication is crucial to obtaining a high-quality image while ensuring the patient's comfort. What approach should the technologist take to manage the patient's anxiety? A. Provide detailed instructions on the procedure and reassure the patient that the process is quick and painless. B. Allow the patient to take breaks during the procedure to help reduce anxiety. C. Perform the procedure quickly to minimize the patient's discomfort and move on to the next patient. D. Avoid speaking with the patient and proceed with the imaging procedure to save time. Answer. Correct answer. A. Provide detailed instructions on the procedure and reassure the patient that the process is quick and painless. Explanation. Effective communication is crucial to reducing patient anxiety during imaging procedures. By providing clear instructions and reassuring the patient, the technologist can help the patient feel more at ease, which in turn can improve cooperation and result in higher quality images. This approach aligns with best practice in patient care and radiology professionalism. Question 10. Considering the evidence from recent studies, advances in imaging technology, particularly the use of machine learning and artificial intelligence (AI), have the potential to revolutionize radiology practice. However, these innovations also raise concerns regarding the interpretability and transparency of AI algorithms used for diagnostic purposes. What is the most appropriate action for radiologists when integrating AI technologies into practice? A. Rely on AI recommendations exclusively, as they are based on vast amounts of data and are highly accurate. B. Use AI recommendations as A supplement to human interpretation, ensuring that radiologists remain involved in the final decision-making process. C. Implement AI without any additional training or oversight for radiologists, as it will enhance their workflow efficiency. D. Completely reject AI technologies as are prone to errors and cannot be trusted for diagnostic purposes. Answer. Correct answer. B. Use AI recommendations as a supplement to human interpretation, ensuring that radiologists remain involved in the final decision-making process. Explanation. AI in radiology can greatly enhance diagnostic capabilities, but it is important that radiologists remain involved in the final interpretation of results. AI algorithms should be seen as tools to assist human professionals rather than replace them. This ensures that the technology is used responsibly and that patient care remains at the forefront of decision-making. Question 11. When analyzing the role of radiology in oncology treatment, Dr. Smith, a radiologist, has just completed an imaging procedure for a patient diagnosed with lung cancer. The results show a noticeable tumor reduction after chemotherapy. However, the oncologist is uncertain whether the response is due to the chemotherapy or other factors like radiation therapy the patient received. How should Dr. Smith proceed to ensure the accuracy of the diagnosis? A. Review the medical records and collaborate with the oncologist to distinguish between chemotherapy and radiation effects. B. Make a note in the imaging report to indicate that the results are inconclusive, leaving the final diagnosis to the oncologist. C. Conduct additional imaging studies, focusing in MRI scans, which may give more precise tumor information. D. Refer the patient back for further chemotherapy and assess the next risk before making any conclusions. Answer. Correct answer. A. Explanation. The most appropriate action for Dr. Smith is to review the medical records, consult with the oncologist, and clarify which treatments the patient has received. This helps establish a clear distinction between chemotherapy and radiation effects, facilitating accurate interpretation of the imaging results. According to the ACR guidelines on collaborative care, it's critical for healthcare providers to work together to interpret complex cases accurately. Furthermore, patient history and treatment records are vital in clinical decision-making. Question 12. In the context of radiology accreditation, Mr. Johnson, a manager at a radiology facility, is tasked with ensuring the department's equipment complies with ACR accreditation standards. He is unsure about the specific testing procedures required for MRI machines. Which of the following best describes the necessary steps to ensure compliance with ACR standards for MRI? A. Perform annual testing of the MRI machine's magnetic field strength and image quality. B. Only test the MRI machine if a new model is purchased, as older machines are exempt from testing requirements. C. Test the MRI machine once every 2 years as per ACR guidelines for performance and safety standards. D. Ensure that the MRI machine is inspected by a qualified service engineer every 5 years. Answer. Correct answer. A. Explanation. According to the ACR accreditation standards, annual testing of MRI equipment for both magnetic field strength and image quality is essential to meet performance and safety benchmarks. The tests ensure that the equipment maintains optimal performance, complies with safety protocols, and delivers accurate results. Ignoring these standards may lead to accreditation issues or compromised patient safety. Question 13. During the process of quality control in radiology, Dr. Davis is performing tests on an X-ray machine. The images are blurry and difficult to interpret, which can result in diagnostic errors. What would be the first step in troubleshooting this issue according to ACR guidelines? A. Replace the X-ray tube immediately to avoid further diagnostic errors. B. Check for issues with the film or digital receptor and adjust settings accordingly. C. Contact the manufacturer and report the equipment malfunction for a replacement. D. Recalibrate the X-ray machine and check alignment for potential mechanical issues. Answer. Correct answer. B. Explanation. The first step in troubleshooting blurry X-ray images is to check the film or digital receptor and ensure the settings are correct. According to ACR quality control guidelines, improper settings or faulty receptors can lead to poor image quality. Recalibration and alignment are important, but they should be done after addressing potential issues with the receptor and image acquisition settings. Question 14. In light of recent developments in digital imaging (MS), Peterson, a radiologic technologist, is considering adopting a new digital radiography system. She is concerned about the system's radiation dose to patients. Which of the following best addresses MS? Peterson's concerns: A. The new system will automatically reduce radiation doses, making manual adjustments unnecessary. B. Digital radiography systems generally reduce radiation dose compared to traditional film, but dose optimization should still be a priority. C. Radiation dose is not a concern in digital radiography, as the technology does not require ionizing radiation. DMS. Peterson should only use the system for research purposes. Evaluate its radiation dose. Answer. Correct answer. B. Explanation. Digital radiography systems are known to reduce radiation doses compared to traditional film-based systems, but it is still important to prioritize dose optimization. This is in line with the ALARA, as low as reasonably achievable, principle, which emphasizes minimizing radiation exposure while maintaining diagnostic quality. Even with digital systems, proper settings and dose management are crucial for patient safety. Question 15. Given the circumstances Dr. Taylor is reviewing, a patient MRI results to assess the effectiveness of treatment for neurological disorder. The results show subtle changes in brain tissue, but the differences are not significant enough to make an immediate clinical decision. What would be the most appropriate next step in this situation? A. Wait for the next scheduled MRI and compare the results to confirm the progression of the disorder. B. Consult with other specialists and request additional diagnostic imaging to monitor changes in the patient's condition. C. Make decision based on the current MRI and initiate treatment adjustment immediately. D. Document the findings in the patient's record but refrain from taking any immediate action. Answer. Correct answer. B. Explanation. In cases where imaging results show subtle changes that are not yet conclusive, consulting with other specialists and requesting further diagnostic imaging is a prudent approach. This ensures a comprehensive evaluation before making treatment decisions. According to ACR guidelines, collaboration and further monitoring are key to improving patient outcomes, particularly when imaging findings are ambiguous. Question 16. When considering the impact of ionizing radiation in pediatric imaging, Dr. Evans is concerned about minimizing radiation exposure during X-ray procedures for children. Which of the following practices should be prioritized to comply with radiation safety standards? A. Use the highest possible radiation dose to ensure the best image quality for pediatric patients. B. Always opt for alternative imaging modalities like ultrasound or MRI to avoid radiation exposure entirely. C. Tailor radiation doses to the patient's age, size, and clinical condition using the ALARA principle. D. Administer standard dose of radiation regardless of the child's size or medical history. Answer. Correct answer. C. Explanation. The ALARA principle dictates that radiation exposure should be kept as low as reasonably achievable, particularly in pediatric patients who are more sensitive to radiation. Tailoring the radiation dose based on the child's size, age, and clinical condition ensures safety while maintaining diagnostic image quality. Using alternative imaging methods like ultrasound or MRI may be considered if appropriate. Dose optimization should always be the first priority. Question 17. According to recent studies, Dr. Miller is tasked with improving the quality control procedures in her radiology department. She is considering implementing a statistical approach to monitor and evaluate imaging quality. Which of the following statistical methods is most commonly used to ensure imaging quality in radiology departments? A. Linear regression analysis to predict future image quality based on past data. B. Statistical process control (SPC) charts to monitor variations in image quality over time. C. Chi-squared tests to assess the significance of differences between imaging modalities. D. Z-scores to compare the performance of different imaging equipment models. Answer. Correct answer. B. Explanation. Statistical process control (SPC) charts are a standard method used to monitor variations in image quality over time in radiology departments. These charts help identify any deviations from expected performance, allowing departments to take corrective actions to maintain high-quality imaging standards. SBC is a key element of continuous quality improvement as highlighted in ACR quality control guidelines. Question 18. The central argument for integrating artificial intelligence (AI) in radiology is to enhance diagnostic accuracy and efficiency. Dr. Roberts is exploring the potential use of AI algorithms in detecting lung cancer on chest X-rays. What is the primary concern Dr. Roberts should address before implementing AI-based tools in clinical practice? AI algorithms should be able to replace radiologists, eliminating the need for human interpretation. AI tools must be validated and proven effective in a wide range of clinical scenarios before being used for clinical decision-making. AI tools must operate without any oversight from human radiologists, ensuring complete autonomy. AI should be used only for research purposes, not for care, until more data is available. Answer. Correct answer. B. Explanation. The primary concern before implementing AI tools in clinical practice is ensuring they have been validated through rigorous clinical trials to demonstrate their effectiveness across various scenarios. This validation is essential to confirm that AI can accurately detect and diagnose conditions like lung cancer. AI tools should assist radiologists rather than replace them, ensuring that human oversight is maintained at all times. Question 19. To better understand the challenges in radiology accreditation, Dr. Thompson, an administrator, is reviewing the requirements for the ACR accreditation process for a newly established radiology facility. Which of the following best reflects the primary focus of ACR accreditation for radiology facilities? A. Ensuring that facilities only meet basic safety standards without considering patient care. B. Focusing solely on compliance with equipment maintenance schedules. C. Evaluating the overall quality of patient care, imaging practices, and safety protocols in the facility. D. Prioritizing the financial performance and profitability of the radiology facility. Answer. Correct answer. C. Explanation. The primary focus of ACR accreditation is to assess the quality of patient care, imaging practices, and safety protocols within a radiology facility. This ensures that the facility meets national standards for diagnostic accuracy, safety, and quality, contributing to improved patient outcomes. Financial performance is not the focus of accreditation, but proper management and resource allocation are essential, supporting quality care. Question 20. Mr. Williams, a radiology manager, is evaluating the financial aspects of radiology services in his department. He is concerned about billing and reimbursement procedures, especially regarding the use of contrast agents in imaging. Which of the following best reflects the guidelines for billing and reimbursement for contrast agents used in radiology? A. Contrast agents are reimbursed separately from the imaging procedure with specific codes for each type of contrast used. B. Contrast agents should be included as part of the imaging procedure fee and not billed separately. C. Reimbursement for contrast agents is determined by the imaging modality used, not the specific contrast agent. D. Contrast agents are reimbursed only if they are used for MRI procedures, but for X-rays or CT scans. Answer. Correct answer. A. Explanation. According to ACA and CMS guidelines, contrast agents are typically reimbursed separately from the imaging procedure with specific billing codes for each type of contrast used. Proper documentation and correct coding are essential for accurate billing and reimbursement processes. This ensures that facilities receive proper compensation for the costs associated with the use of contrast agents in imaging procedures. Question 21. In the context of radiological safety and diagnostic precision, Dr. Brown, a seasoned radiologist at a high-volume imaging center, is confronted with the challenge of optimizing CT scan protocols for a diverse patient population. Recently, the center adopted a new low-dose CT protocol designed to minimize radiation exposure. However, during routine reviews, Dr. Brown discovers that patients with complex clinical profiles, particularly those with higher body mass indices or multiple comorbidities, require adjustments to the standard protocol to achieve diagnostically acceptable image quality. He is now tasked with balancing the ALARA as low as reasonably achievable principle against the need for diagnostic clarity, especially when higher doses may be necessary for adequate imaging. Dr. Brown consults current ACR accreditation guidelines and relevant literature to decide on the best approach that safeguards patient safety while ensuring high-quality diagnostics. A. Strictly adhere to the standard low-dose protocol for all patients regardless of individual needs. B. Increase the radiation dose for all patients uniformly to ensure image quality. C. Adjust the radiation dose on per patient basis considering individual clinical factors while adhering to ALARA principles. D. Delay imaging for complex cases until alternative diagnostic methods are available. Answer. Correct answer. C. Adjust the radiation dose on a per patient basis considering individual clinical factors while adhering to ALARA principles. Explanation. Individualized dose optimization is essential to maintain image quality without compromising patient safety. The ALARA principle guides minimizing radiation exposure, but clinical circumstances sometimes require dose adjustments. By tailoring the dose to each patient's specific needs, Dr. Brown complies with ACR standards and upholds patient care quality. Question 22. In light of current accreditation guidelines, Ista Garcia, a dedicated radiologic technologist at a busy hospital, is responsible for ensuring that the department's ultrasound equipment is operating at peak performance. Recently, a subtle decline in the clarity of ultrasound images has been observed, potentially impacting diagnostic accuracy. Ista Garcia suspects that the degradation might be due to calibration issues or routine wear and tear. To address this, he reviews the calibration logs and compares the current performance against the manufacturer's recommendations and ACR quality control standards. Additionally, he considers environmental factors that might have contributed to the equipment's performance decline. His goal is to restore the optimal functionality of the ultrasound system, document all corrective measures in accordance with ACR protocols, immediately recalibrate the ultrasound machine, and thoroughly document the process. B. Schedule the recalibration for the next routine maintenance cycle without immediate intervention. C. Contact the manufacturer for technical support before attempting any recalibration. D. Continue using the equipment and monitor the situation further before taking any action. Answer. Correct answer A. Immediately recalibrate the ultrasound machine and thoroughly document the process. Explanation. Prompt recalibration and documentation ensure that any deviations from optimal performance are corrected immediately, maintaining compliance with ACR guidelines and safeguarding diagnostic quality. Question 23. Through the lens of quality improvement initiatives, Dr. Nguyen, a department head at an academic medical center, is leading a project aimed at enhancing diagnostic imaging performance. The initiative focuses on streamlining workflow and reducing patient wait times while ensuring that the quality of imaging remains uncompromised. However, Dr. Nguyen faces resistance from staff accustomed to traditional processes, which may hinder the project's success. To overcome these challenges, she reviews several case studies that highlight the benefits of inclusive change management. Recognizing that sustainable improvements require active staff engagement and feedback, Dr. Nguyen contemplates implementing regular interdisciplinary meetings and training sessions. She is determined to align the initiative with ACR accreditation standards while fostering a collaborative environment. A. Impose the new changes without soliciting staff feedback to maintain strict timelines. B. Limit the initiative to minor workflow adjustments to avoid overwhelming staff. C. Engage all team members in the planning process and incorporate their feedback to foster ownership. D. Schedule training sessions only after the complete implementation of the new workflow. Answer. Correct answer. C. Engage all team members in the planning process and incorporate their feedback to foster ownership. Explanation. Inclusive change management promotes staff buy-in and ensures the sustainability of quality improvement efforts. Active involvement and feedback help tailor the initiative to the department's needs while adhering to ACR standards. Question 24. Considering the importance of equipment performance evaluation, Ista Lee, a senior imaging technologist, is assigned the task of assessing a newly installed digital X-ray machine. This equipment is pivotal for diagnosing musculoskeletal injuries, and even minor deviations in image quality can compromise diagnostic accuracy. During preliminary tests, Ista Lee notices subtle inconsistencies in image contrast and resolution. Concerned about these discrepancies, he documents the observations and initiates troubleshooting by reviewing manufacturer guidelines, consulting with colleagues, and considering both hardware and software factors that could be affecting performance. In alignment with ACR accreditation standards, Ista Lee must decide on the most appropriate next step to ensure the machine operates optimally and safely. A. Replace the machine immediately to eliminate any risk of diagnostic error. B. Perform a comprehensive calibration and quality control test to identify and correct the issue. C. Report the inconsistencies to ACR. 4. A potential temporary waiver of quality control requirements. D. Continue using the machine while closely monitoring its performance over time. Answer. Correct answer. B. Perform a comprehensive calibration and quality control test to identify and correct the issue. Explanation. A thorough calibration and quality control evaluation will pinpoint the cause of the inconsistencies and ensure the equipment meets ACR performance standards, thus maintaining diagnostic integrity. Question 25. Given the circumstances surrounding patient privacy and data security, Dr. Martinez, a radiologist at a metropolitan hospital, is reviewing departmental protocols to ensure compliance with HIPAA regulations amid the growing reliance on digital imaging and electronic health records. With increased risks of data breaches, Dr. Martinez is particularly focused on the secure handling, transfer, and storage of patient imaging data. Carefully examines existing workflows and identifies areas where stronger encryption and access control measures could significantly enhance data protection. Additionally, Dr. Martinez considers implementing regular staff training sessions on data security practices to further mitigate risks. His objective is to align departmental protocols with both HIPAA requirements and ACR accreditation standards, ensuring that patient confidentiality is maintained. A. Restrict access to imaging data by implementing role-based permissions and robust encryption protocols. B. Limit the digital transfer of images by using physical media exclusively. C. Encourage staff to memorize patient information for quicker retrieval, minimizing digital data use. D. Outsource all data handling to external vendors without establishing internal oversight protocols. Answer. Correct answer. A. Restrict access to imaging data by implementing role-based permissions and robust encryption protocols. Explanation. Enhancing access controls and encryption safeguards patient data, fulfilling HIPAA requirements and supporting ACR accreditation standards regarding patient privacy and data security. Question 26. In response to the growing trend of integrating advanced technologies in radiology, Carter, the head of a radiology department, is evaluating an AI-assisted diagnostic tool designed to detect early signs of neurological disorders in MRI scans. The tool uses sophisticated machine learning algorithms to analyze images and highlight potential abnormalities. While the promise of increased diagnostic accuracy and efficiency is Staccato is also mindful of the challenges, including issues of interpretability, regulatory compliance, and ensuring that the technology supports rather than supplants human expertise. He reviews the latest ACR guidelines regarding the integration of emerging technologies and contemplates a pilot program to assess the AI tool's efficacy, safety, and impact on workflow. A. Deploy the AI tool immediately across all imaging studies to maximize efficiency. B. Use the AI tool solely for research purposes until further validation is completed. C. Implement pilot program to validate the tool's performance and integrate it as decision support system alongside radiologist oversight. D. Rely exclusively on AI outputs for diagnostic decisions, eliminating the need for radiology interpretation. Answer. Correct answer. C. Implement the pilot program to validate the tool's performance and integrate it as decision support system alongside radiologist oversight. Explanation. Pilot program allows for careful evaluation of the AI tool under real-world conditions, ensuring it enhances diagnostic capabilities while complying with ACR guidelines and maintaining essential human oversight. Question 27. Throughout the course of managing radiology equipment MS, Cooper, a seasoned equipment manager, is tasked with overseeing the decommissioning of an aging PET scanner that contains radioactive components. The safe disposal of these materials is critical to prevent any potential radiation hazards to staff and the public. In preparing for the decommissioning MS, Cooper meticulously reviews national and ACR guidelines regarding radioactive material handling, disposal. She coordinates with the hospital's environmental safety team and an approved radioactive waste disposal contractor to ensure that every step, from removal and containment to final disposal, is documented and executed according to regulatory standards. Her detailed approach reflects the department's commitment to both safety and regulatory compliance. A. Immediately discard the radioactive components with standard medical waste. B. Follow all approved protocols for radioactive material disposal and document each step comprehensively. C. Store the components indefinitely until more permanent disposal solution is developed. D. Sell the decommissioned PET scanner without addressing the radioactive components. Answer. Correct answer. B. Follow all approved protocols for radioactive material disposal and document each step comprehensively. Explanation. Adhering to established protocols and documenting the disposal process ensures compliance with both ACR standards and national regulations, thereby protecting staff and the community from radiation hazards. Question 20. In a context of legal and ethical considerations in radiology, Dr. Patel, an experienced radiologist, faces a challenging situation where a colleague's interpretation of imaging studies appears to deviate from established diagnostic protocols, potentially leading to misdiagnoses. Concerned for patient safety and aware of the ethical duty to maintain high standards of care, Dr. Patel must decide how to address these discrepancies. After reviewing relevant ACR guidelines on peer review and ethical practice, he considers the merits of discreet, collegial discussion versus an immediate formal report to the department head. Recognizing that resolving such issues internally can often lead to constructive improvements without damaging professional relationships, Dr. Patel opts for measured approach. A. Ignore the inconsistencies to avoid any potential conflict with his colleague. B. Discuss the discrepancies privately with his colleague to encourage review of the cases and promote corrective action. C. Immediately escalate the matter to the department head without prior discussion. D. Publicly criticize the colleague to alert other staff members of the issue. Answer. Correct answer. B. Discuss the discrepancies privately with his colleague to encourage a review of the cases and promote corrective action. Explanation. A private, collegial discussion upholds ethical standards and patient safety while providing an opportunity for corrective feedback in line with professional guidelines and ACR standards on peer review. Question 29. Within the framework of multidisciplinary care, MS, Reed, a meticulous radiologic technologist, plays a pivotal role in ensuring seamless collaboration among radiologists, oncologists, and surgeons. Recently, a complex case involving ambiguous imaging findings prompted a multidisciplinary meeting to determine the best treatment approach. A key element in this collaboration is the accuracy and accessibility of imaging data. MS. Reed is responsible for ensuring the detailed images and annotations are uploaded promptly to the electronic health record system and are easily accessible to all relevant specialists. She reviews the department's workflow to identify any potential bottlenecks and take steps to streamline data sharing. Her efforts are crucial in aligning with ACR accreditation standards that emphasize precise documentation and interprofessional communication. To support optimal patient care, ensure that imaging data is promptly uploaded with detailed annotations and accessible to all members of the care team. B. Restrict access to the imaging data solely to radiologists to minimize data exposure. C. Delay the sharing of imaging data until a complete set of follow-up tests is conducted. D. Share only summary reports rather than full imaging data to reduce information overload. Answer. Correct answer. A. Ensure that imaging data is promptly uploaded with detailed annotations and accessible to all members of the care team. Explanation. Timely, detailed, and accessible imaging data supports effective multidisciplinary collaboration and aligns with ACR standards, ultimately improving patient outcomes. Question 30. The primary reason for incorporating advanced imaging studies is to enhance diagnostic accuracy and improve patient outcomes. Dr. Kim, an expert in nuclear medicine, is reviewing a series of PET scans used to assess the metabolic activity of tumors in oncology patients. Although most images are of high quality, some scans exhibit unexpected artifacts and inconsistencies, which could potentially compromise the accurate assessment of tumor activity. Aware of the stringent quality control standards mandated by ACR accreditation, Dr. Kim is considering several measures ranging from recalibrating the equipment and adjusting scanning protocols to consulting the manufacturer regarding potential software updates. His decision must balance the urgency of obtaining reliable diagnostic information with the need to adhere to established quality standards. A. Ignore the artifacts if they do not appear to affect the overall diagnosis significantly. B. Recalibrate the PET scanner and adjust the scanning protocols to eliminate artifacts and improve image consistency. C. Immediately replace the PET scanner with newer model to ensure artifact-free images. D. Delegate the evaluation to less experienced technologists to expedite the process. Answer. Correct answer B. Recalibrate the PET scanner and adjust the scanning protocols to eliminate artifacts and improve image consistency. Explanation. Recalibration and protocol adjustments are critical steps in addressing imaging artifacts. These measures ensure that the PET scans meet ACR quality standards, thereby maintaining diagnostic accuracy and optimal patient care.